What if aging wasn't something that just happened to you, but something you could design with purpose? What if you could take the wheel? Today on Always Ageless, we're talking with April Ibarra, a gerontologist, a certified senior advisor, and chief aging officer who helps boomers like us, solo agers, and caregivers turn the later years into their best years. Sounds pretty good. With over 35 years in senior care, April brings a rare mix of heart and know how to guide people through life's transitions, building support systems, protecting independence, and redefining what it means to grow older. Because certainly there are so many more of us growing older in this population surge. So if you've ever wondered how to age on your terms or help someone you love to do the same, this conversation is for you. We are so honored to have April Ibarra with us. April, thank you for joining us on Always Ageless.
Well, hello and thank you, Valerie. I'm thrilled to be here. You and I have so much to talk about.
We do. And we know that there's a lot of emphasis now on the aging population because it's become a greater part of our population, a greater age demographic. But you've been doing this for a long time. So I
Mhm.
wonder if you've seen some differences in how this is being handled or managed or anticipated, I guess.
Yeah. I've been waiting for this forever, my whole life. I mean, when I started out, I was, barely 20 years old, and I started teaching exercise classes in a nursing home. And I thought, I think we're on to something here. Exercise is the key. We have to keep moving. And I've been passionate about it ever since. And I've been waiting and waiting for everyone else to get on board.
Really?
Yeah.
So you
I mean,
started by teaching exercise
I
classes?
did. That was one of my first jobs in senior health, and I was literally in a nursing home. Back then, I don't even think we had assisted living. You either had sort of a congregate housing or you had a nursing home. There wasn't much in between. And
Right.
I would go in as they would call me, the young whippersnapper, and
Sure.
I would come in, but I had a relationship with these people, and I loved how it made them smile and made their lives a little bit better. And I always started by saying, listen, how many of you want help? And, one of the things I would say is, who wants help getting on and off the toilet? And people would look at me kind of like, did you just ask me that? And I said, it's not because we're older that we need help. We also have to keep our body strong and moving. So I've always been a little sassy like you in taking that approach and saying, listen, we've got to take charge of how we age. We have some choices.
So tell our audience what first inspired you to focus on this career and on senior wellness.
Yeah. I think I was always into health. When I first went to college, I studied health and wellness, and worked in corporate health and fitness. But I remember when my grandmother started getting older, I was just determined that I can make this better for you, Grandma. And she did
Aw.
exactly what I said. She went from a congregate senior living housing. She didn't have a lot of money, so she was in sort of a low income housing, and then she went to a nursing home, and I knew I was afraid she was going to decline. So I would go in there, and at Christmas, I got her some little 5 pound weights, and I'd go in with her and I'd sit there and exercise with her. And I just always in my heart, I knew that we have to move. So I minored in gerontology in undergrad, and then I went back and got my master's in gerontology, and from there it just kept growing.
But a master's in gerontology at that time, I mean, who else was doing it?
Right. People didn't even know what it was. I think it's strange. And I was sort of a non-traditional student.
Oh,
I
I'm
moved
sure
in,
you were. Yes, I'm sure you were.
I'm always non-traditional. I think
My
you and
kind of
I
girl.
have,
Yeah, absolutely. I
yeah,
know. I know.
yeah.
Yeah.
So I was already, I moved out of my home when I was 18. I thought I'm going out into life. And back then, not everybody went to college back then. So I actually got married, and unfortunately divorced before I even went to school. So I had some time to think about what was important to me. And exercise and health was always important to me. And so as I studied the minor in gerontology and started digging in, I thought, I went back not long after I finished and went ahead and got the master's. And at that time, I could have sat for my administration license. I could have been a licensed nursing home administrator. And even at that young age, I thought, no. I mean, I was always for, yes, there's a time and a place when somebody does need more care, clearly. But we never talk about prevention. We just talk about the end, the demise. How are we going to handle people with Alzheimer's? How are we going to handle people with disease and disability? We never talk about, there's a lot of things we can do to slow down or in some cases prevent. So, and that passion has never changed. And now I'm older.
Well, I don't know about that.
Well, I'm older.
We're older than we were 35 years
That's
ago.
right.
That's for sure.
That's right.
So how did those early experiences teaching fitness shape you into your approaching gerontology? Just that you thought that you wanted to go more into preventive position?
Yeah, I refused to take any roles in my career that weren't more empowering and just trying to keep people living their best life. I didn't, at the time, I really, I worked very short term in some senior living communities, but I was always like, let's focus really on how well we age, not what happens when we can't do things. And so I just always, kind of had that in my mind, and I know, and I read more now than ever. I feel like I'm always a student. I have a stack of books here on my desk, and I am getting excited because I spent a long time in corporate health and wellness and doing fitness programs for retirees and doing all these kind of things. And then eventually it was like, I just felt like nobody was paying attention, right? I think older adults are more motivated because as they start aging, they start realizing if I want to do things for myself, I'm going to have some strength. I'm going to have some mobility. I'm going to have to think about these things. But, younger people were like, they just weren't that interested, So I sort of transitioned a little bit out of wellness. And I went into actually work for a medical device company, Lifeline, the medical alert company. I spent about 15 years there because I was also determined, knowing that so many people do fall and that it is a life-changing event for so many people, that, gosh, if we can prevent somebody from having a fall or help them to get help quicker. So that was a passion of mine as well. And now I reached a point after, a couple of layoffs from corporate jobs throughout my career that now I have the opportunity to work for myself and put together everything I've learned and everything that I'm passionate about. And I said, I'm just going to go out on my own. And now I get to do and say whatever I want.
But going out on your own really means going out and serving. Yes. Because you are all about making a difference.
Yes.
So going out on your own.
I don't do anything. Yeah. I don't do anything I don't want. So, which is good because I don't have to have sort of I'll say the corporate speak, right? I mean, I can go out and talk to groups and do exactly what I want. So I've built my career now around serving and trying to empower, if I could say I do anything, older adults to say, you know what, you've got this. Things may have changed in your life, and we all have, some declines. We're all dealing with some sort of chronic illness to some degree. I mean, I have arthritis, I have autoimmune disease, and I'm dealing with that myself. But that doesn't mean we're over by any stretch.
No, it doesn't. We'll save some of my comments for later on because I have my own strong opinions about being treated like we're old. So how has your thinking on aging with intention evolved over your decades-long career?
Yeah, I mean, as I started working on, building my own business, I do some care management. So I do go in and help people, who are trying to walk the journey in a very complicated world, as most people who have tried to figure out what do I do when I have, early stage dementia, or, I've just had a stroke, or my husband just died and I don't know what to do. It gets very complicated. So, I mean, I knew I had to guide people in that path, but I also knew that we're not, again, talking about what do I want my life to look like. It's happening just, when we act shocked all of a sudden, oh my gosh, I just turned, 75, and now I'm dealing with this or that. We know it's coming. And I think a lot of times we do kind of flow through life anyway, just, taking it one step at a time. But I think after you turn 50, in my opinion, you have an opportunity to sort of look forward and say, now I can start making some decisions about what I'd like my life to look like. And I do believe that if people age with intention, that they can look forward and say, I want this, I don't want that. I'm going to communicate this to my adult children, perhaps. I'm going to create the life. I'm going to live where I want to live. I'm going to live how I want to live. And I'm going to take some responsibility for things that I need to do that. Meaning, have hard conversations, even with yourself, to say, I'm not doing some of the things I need to do that's going to benefit my health. And that's, I always look holistically, right? So it's not just health. It's not just let's exercise. It's the social connections. Do you have good relationships in your life? Are there people in your life maybe who aren't so good for you? Where am I spiritually? Am I on an ongoing learning, lifelong learning path? I mean, we never stop learning. We're never too old to do something new. So kind of that's how I go forward. I was actually speaking yesterday. I go out and talk to a lot of groups, and I have a topic called wellness for longevity. And we had just a great conversation with some folks living in independent living and assisted living. And this one lady kind of raised her hand, and she's 83. And she said last year she went skydiving.
Oh, good for her.
And everybody in the room was like, looked at her like, what? And we were just like applauding her. It's like, yeah, do something you're afraid of. And, she was just had the most wonderful spirit, because I think she had not given up. She had not, believed in that defeat attitude that, no, I'm too old now. I need to behave a certain way. I'm like, oh, no, you don't.
No, you don't. You don't. We don't. You don't.
You don't.
So that's aging with intention. I just, I'm sure we could spend hours going through all these things I'd love to talk to you about, but it's so frustrating for me that people and society take a position that an age then equals old.
Right.
And that old equals something negative.
Yeah.
And I see all of these things about people over 55 or 55 plus. What does that have to do with anything?
Nothing.
And 55 plus is nothing. 55 is nothing. It should be 75 or 85.
Right.
But for people to be made to feel or feel on their own that old means now I have to give up things, that it's your age. And we talked about this. There's a book I love called Stage Not Age. We should talk about the stage we're in. And if you are healthy, and you are have friends and all those things, you could just extend your life. But I see even with, within the cities, right, in the communities, we treat, all of a sudden people are old, so we have to do certain things.
Right.
We just assume that they're disabled or
right.
unable to do things, right?
Yeah. But I talk about ageism a lot, because I think we internalize ageism ourselves, probably more than we see it outside in the world. I mean, there's certainly ageism, right? But we can't wait for the world to change around us. I mean, when I go out and talk to groups, I'm like, we're going to do this one group at a time, one person at a time. If you believe that you still have some power within you, which you do, you still have something to give, which you do, then, the world will start to change around us, because, we're pretty much taking over the world. And so we can't just sit around and everybody's individual. So, what works for me doesn't work for you. But that's why I say with intention, it requires some thought. And I do some workbooks and worksheets, and I sit down with people and I have them reflect across all their life, right? Where do they live? How do they live? Who do they live with? Um, Legal and financial preparations. I mean, you can't put your head. How many people do not have a basic power of attorney? And then all of a sudden, I worked in elder law for a little bit of time, and I
Oh,
saw day after day. Somebody would be in the hospital. They had a stroke, which they weren't planning on. It just
yeah.
happens. They're incapacitated. Nobody can speak on their behalf. Bills can't be paid without a financial power of attorney. And it's just like, why are we so afraid to talk about these things?
Mhm.
And all the
Right.
way to, your emotional well-being, your social stuff, purpose, but also end of life. I mean, it's pretty clear none of us are going to live forever. Why are we so afraid to talk about how we want to die? Putting our wishes out there, and I believe dying with dignity. And I'm thrilled now that there are end of life doulas, right? Which is, I mean, some people, I heard somebody talking about a birth doula the other day, and I said, "Did you know there's end of life doulas?" And they kind of looked at me like I was crazy. And I said, "No,
Yeah.
somebody to walk by their side and help them leave this earth the way that matters to them."
Right. The way that they want to,
Yeah.
and
So
to
you
know
have
that
to be
they have the choice.
intentional. You have to think ahead and really explore. And that's the beauty to me about getting older. I feel like, we're much more in tune with ourselves, usually. We kind of know ourselves a lot better than when we were 20 or 30 or 40, even. And so we've got some pretty good opinions, and we know what we want and what we don't want. So we should put that into writing and create a life plan that serves us well.
And it really is so much better for the family.
Oh,
My son was in a situation with a distant family member where, as soon as the family member passed away, they just walked across the street to the mortuary. Everything was planned. It was so much easier for the family. There was no fussing, no arguing, no, well, I want this, I want that. Just
no, no,
all
no,
settled.
no.
Everybody could just go on, and it could be a pleasant experience for everybody.
Absolutely. It should be let's celebrate their life. Let's not fight about how it ended, who didn't do what, and who gets what. And as you well know, it happens.
It does.
Yeah.
Yes, it does. I was in the middle of a situation yesterday that was like that. What unique challenges or needs do you think there are with solo agers? What do they face compared to those traditional support
Yeah.
networks?
Yeah.
Is there something unique for
Well,
them?
yeah. I mean, I think with solo agers, and I'm glad you called them solo agers and not orphan elders. I
Oh,
was in
yeah.
I was in a seminar the other day, and a brilliant, brilliant elder law attorney, but he called them orphan elders. I'm like, that's
Oh,
not the
'cause-
best term. I personally don't have any children, so there's nobody going to take care of me. And I think the term is broader than just not even having children. It's just somebody who is more been living their life on their own. So I think that type of person is much more willing and open to looking to the future to say, well, what's going to happen when I get older and may need something.
Mhm.
And I love that so many people are thinking creatively. I have a friend who actually, I think they're both in their, they might be in, they're in their 70s, and she just built a new house, and her best friend moved on the other side of the house. In the middle, they have a communal kitchen, so they get
Oh,
in, have their coffee, they share that space, and then they both have their own places, but they're there for each other and they're looking to the future. And we need more of that. And I
yeah.
think people do just assume, well, my children are going to take care of me. I'm like, well, what does that
And
look like?
yeah, and the children are thinking, right? What am I stuck with? And of course, something that we see so often now is that people who are the adult children of aging parents are saying, "Yeah, but I'm retired now,
Yeah,
and my mom's still alive,
right, right,
and what happens with my retirement? Because now I've got to take care of my mom or my
right,
dad or my grandma or whatever.
right.
Now I don't have a life." And
Right.
that's
and there's so much research and so many data points out there now to talk about caregivers are the unpaid workforce, and it's unfortunate because of unfortunately some people have not really prepared and they're not in the best health. I mean, if you're not in good shape as a younger person, when you get older,
Probably not going to be better.
it's a perfect storm, and quite frankly, adult children assume that they have a responsibility or want to take care of their parents, and I think they often do that out of love and kindness, but they also try to take control of the situation because they're so concerned about the safety. Oh, mom, you can't do this. Mom, don't do that. I'm afraid, and then it becomes this battle of the minds, because they don't really understand that people don't want to have their control taken away from them.
No,
So you can't just
no.
come in and say, well, you can't do this, mom. Everybody's allowed to make bad decisions, even when you're older.
Right, right. Or good decisions. And it's not up to the children
Right,
to say, because you're old, I'm now your boss.
right, right. I mean, if anybody ever says to me, I'm caring for my, or what do they call it? I'm now parenting my parents. I'm like, no, 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 no. You're never parenting your parents. And that all goes back to communication as well. If you've never talked about these things, and then there's a diagnosis or there's a fall or something happening, then you don't know what to expect. And then you're going into a crisis, and you're just not set up for success because you've never even had the conversation about what would this look like.
Yeah. I almost wonder, April, if we shouldn't have more education for the children.
I have tried and tried and tried. And it's not going to stop me from keeping, trying, but I find that most people just do not, they wait until there is a crisis, and then everything's different then. Your options are less. So that's why I do what I'm doing now. I talk to people, and I've created these workshops, the empowered caregiver, helping the caregivers understand what the family caregivers, what is your role, aging with intention, so the older adults can create their life plan. And then I'm trying to reach that younger population. And to me, that starts at 50, so that people can start to make some good decisions in their life. So maybe you won't have to have somebody care for you. I mean, you certainly want to have that relationship, because those connections with family and grandkids and friends are so important. But that's not caring for somebody, that's caring for somebody,
But the 50-year-olds often they're learning how to be the caregivers, right? Their
Mm-hmm.
parents are in their
Yeah.
80s, hopefully not 70s, but in their 80s and
Mm-hmm.
90s and hundreds, as
Yes.
we have in our household. My mom's 105, almost 106, still lives on her own. And we I know I know that those people probably don't want to have to sit in a class and learn what to do, how to
Mm-hmm.
how to grow into the
Right.
situation with their parents, but they need to, right? We need to have classes. If you are the adult child of aging
Mm-hmm.
parents, right? Nobody talks to them,
Yeah.
right?
Yeah. And early in my career, I did some corporate. I think whatever they used to call it, corporate elder care, corporate,
Mhm.
those types of things where they had benefits for employees. And that conversation's coming up again because, it's taking time away from the workforce when I'm like, I have to go step out and take my mom to the doctor. Oh, mom just fell. The EMS is there. Gotta go. So I think companies do need to step in, and bring people like us in to say, we can help guide these folks ahead of time, so that they know what to expect and are prepared. And it's not, it's not all consuming and so stressful, because caregivers get sick, caregivers go broke,
Yeah.
caregivers die in the middle of their family caregiving journey. So it's important.
It absolutely is. It absolutely is. And something that I think is just not being addressed hardly at
Yeah.
all.
Yeah.
Lots of things for seniors, but not really for
Yeah.
you're going
But
to
I
grow
do
up
see
and
things
be 50 or
changing.
60. Yeah.
Yeah, I mean,
And
I know you talked about that. It's like I've kind of been waiting for this whole thing, not only just preparing for aging, but just health and wellness. And now there's so much talk and there's so much research out there now that is supporting longevity. We are living longer than ever.
yeah,
Whoopie doo is what I say, because so what, we're living longer, but we're also living traditionally the last 12 years of our lives with disease and disability. We need to
yeah,
shorten that up so our health span is better,
right,
so that as we live longer, we're still living better.
right. So I may be older and that's going to happen, and
Right.
maybe I'm going to die and that's going to happen. But why do I have to be sick
Yeah.
just because I'm older?
Right.
Right. We don't want to do that.
Right.
So, how can solo agers intentionally build strong, trusted support systems? Where
hmm
can they go? Are there special places for them or special groups?
I think there is. There's a lot of attention now on solo agers, which I think is fabulous. And so I think there's groups that, I think if you just look up solo agers, you can find people like yourself who are going through the same things. And I think it just starts with your network. Right, just like my friend who built a house, she was getting out of her house because it was no longer appropriate for her. She had a lot of stairs. She knew, she was a nurse. She'd seen things. She'd worked in the ER her whole life, and she knew, this is not the best place for me anymore. So she knew she was going to build a house, and then she thought, and as she went forward, her and her friend talked, and they planned. So you've got a network of people around you, and even if it's as simple as, hey, listen, I'm going to have I'm going to have a hip replacement surgery coming up in a couple of months. Are you able to help me? And then I'll help you when you need to go to the doctor. I'll help you. And, you just start having those conversations with your own circle of folks.
Yeah.
And then, of course, there's organizations. There's people like me. I mean, I'm a certified senior advisor, but I'm also part of Aging Life Care Association, which is an organization of care managers. So those are, we work a lot with solo agers, and we can come in and we can be that person who, well, do you need us to go to the doctor with you to help you interpret what you're hearing? Do you need us to help oversee, your transportation, and maybe help you bring in some care for you, So there are groups. So I do believe there's a lot of focus now on solo agers, which I'm thrilled for.
Absolutely. No, tell us, how do you personally, you do a lot of public speaking,
Yeah.
and you have such a broad experience level because of all the things you've done as well as the length of time you've been doing this. So how do you personalize coaching programs for clients with diverse needs and different backgrounds?
Oh gosh, it starts with building a relationship with them. Every person is different. So what's important to me may not be important to them. So I think it goes back to what a person-centered care, if you're familiar with that concept,
Mhm.
which is, I believe that started out of, I can't remember what hospital system, but it's a sort of a national program. And it's, person-centered care should be built around what are my values and preferences, right? Everybody's values, beliefs, and preferences are different. And what happens with older people is we come in and we want to fix things. You know, uh, you know, you can't stay here. This house is unsafe. You can't have that rug. You can't have that dog. Um,
Right,
Guess what?
right,
And people are so shocked when somebody says, "Get out." I don't want your help, um, because we cannot go in and tell people what to do. Nobody wants, that's not the right way. So you have to get to know that person and understand. And I like to say, what matters most to you, I think is the best thing I can ask somebody. And they'll come up with their
great,
top three
great
priorities,
question. Yeah,
you know.
great question.
Yeah. And then from there, you build it out to say, okay, we can't, we don't have to tackle everything, but we have to start somewhere. Um,
Right.
you know, um, and every time that I start a new client for care management, the first thing somebody says to me is, this person is very difficult. You're going to have a hard time with them. And I'm like, good.
Good.
I like
Good.
somebody who has some pushback and has a mind of their own and is sassy. And it usually just comes down to folks are coming in and trying to change everything about who they are and what matters to them. And we can't do that. It's not going to work. Um,
No. Can you share a success story? Of course, you don't have to give us names,
yeah.
of how intentional aging transformed someone's experience.
Yeah. I just was on the phone. I was visiting a client yesterday, and she is 95. And again, when I got the call, it was like, I got to tell you, this woman's really difficult. I don't know if you're going to be able to work with her. Okay, we'll see. So, with her, I just go and visit weekly. She's a solo ager, actually. Husband's passed, doesn't have any children, some extended, grandkids, other parts of the country. And so she agreed to let me in, which was a good start. And we just started visiting every week. And I didn't have a big agenda when I go in. There's a lot of things that needed to be done, a lot of things that weren't going super well that the people who brought me in were concerned about. But I had to start with her. And so I had my first month with her. We're in August. Yeah, July was my first month. So last week I sat down with her. I said, well, we're moving into another month. Would you like to continue? And she says, oh, yes. I want you here every Wednesday until the end. And then I got off the phone and called her. And some weeks I felt like I'm not doing much here. I hate to, is this helping her or what's going on? And but she was thrilled, the client, and then the family who referred her to me said they have noticed such a huge difference in her behavior. She's more
Of course.
upbeat, she's more hopeful, cheerful, because I think she just felt like, oh, I'm starting to decline and some things are going on. Where she is, she's in independent living. They're like, oh, she needs assisted living. And I'm like, why? You know, they had their reasons, but I didn't see any reasons, So I just encouraged her and my whole purpose for being with her was to lift her up and empower her and remind her perhaps of things that, my job is to make you aware of things that may not be so safe for you. And that's my job, is just to tell you that, not to tell you what to do. And then I've noticed that she responds very well to that. She'll tell me things like, well, I did this and I know you're not going to like it, but I want you to know. And I said, well, good, but you know the risks, right? Oh, yes, I'm very well aware. And, it starts to she starts to gradually change, but she feels empowered. And I'm like, to me, that's a win.
Absolutely.
Yeah.
Yeah, I can see that would be a lot of
Yeah.
fun. So where do you think you make the biggest impact in your work? Is it with your care management program? Is it when you speak to a group and
Mm.
one person responds and you see a little tear, you see someone
Oh,
come up to
God.
you afterwards, or
Yeah.
where do you think you're able to make the biggest difference?
Yeah, that's such a good question. I think about that a lot because I'm a one woman show, so I can only see so many clients, and so I know I love doing that because that's where I learn, right? If I'm working one on one with somebody, I can learn from experience what's happening, what's not working, what they're thinking. I used to work up here in corporate world, and we'd talk about what it was like to serve older people. But how many of us have really been in someone's home talking to them while they're in the middle? So I feel like being really in the weeds helps me to learn the most. But you can't make a huge impact that way because you're doing it one person at a time. So
Yeah.
that's why I do like the coaching and the speaking, because I can go out and talk to larger groups of people and get my hands around them and share the same message and guide them. And then I am always like, now take this out and tell your friends. Go forward, and when somebody acts ageist towards you, call them out on it. When somebody says, I'm too old to do this, call them out and spread the word. So I kind of have three buckets of how I try to approach it. One is individual clients, which I love, and you can't change the one-on-one relationships you build, but then the groups, and then things like this. So any opportunity I have to speak to people, I want to do that, because if one person hears this and is like, yeah, that's me, and I think I can do this, or a family understands that, gosh, I need to let mom be herself and not try to come in and intervene on everything. So I just keep going and getting on stages and talking at conference. I'm actually taking my Aging with Intention workshop idea out to Aging Life Care Association conference, our Midwest conference in Louisville, coming up at the end of the month. So because even care managers, I mean, I think, many of us, some people have a clinical base, so I'm not
Right.
clinical. I mean, I know a lot. I've worked in hospitals and healthcare, but my approach is gerontological. So I look at the individual. I'm not looking at, oh my gosh, your diabetes is out of control. Why is that sugar on the counter? And so I think that's my unique difference. So I think even other professionals who serve older adults need to be reminded that we have to look at the whole person and support them as individuals.
What's your favorite topic when you go out to a group? What do you like to talk about the most?
Yeah, I talk a lot about well, the wellness concept and taking control of your aging journey and going through all of those. All the 7 pillars of wellness. It's just more than just physical, but it's emotional, it's learning, it's purpose, it's spirituality, all those kind of things. But I always talk about one particular concept, a book that I read called Breaking the Age Code by Dr. Becca Levy.
I just I just bought that. It was delivered to my house yesterday.
Oh my God, that's crazy.
I
I
must have seen it on
this
something maybe that you posted. Maybe I saw it somewhere in one of
Oh,
your
okay.
posts.
Yeah.
Maybe.
So I was so impressed with this, and I thought this gives me something very concrete to go out and remind people, because it says in the book, it talks about it's our um, I want to say not our attitude, it's our own beliefs in aging, growing older, that shape how our aging experience will be. And what that means is if we always are, oh, I'm too old to do this, and you start to just slowly shut your life down till you're only sitting in the chair and looking out the window and watching the news, your world is going to be very small. And it also says that people who have a better attitude about aging, they live longer, 7.5 years longer. Okay, I like that, but they
I
live
like that a
better.
lot.
I mean, I was like, whoa, and this is research. And so I like that piece of it, but it also says that all these things that we've not normally thought are age-related declines, even including dementia, heart disease, hearing loss. Many of those disorders have to do with our views on aging.
Hmm.
Now, that doesn't mean people don't still have dementia, or I have heart disease, or I have arthritis, but I also know that that doesn't define me.
Right.
The number on my driver's license doesn't define me. It's how I live my life, how I approach my life, that defines me. And so no matter what I talk about, I always tie in breaking the age code and saying that, guess what, guys, this tells me we have a lot more control over our aging experience. And people always thinks, well, it's my genes. Well, my dad died when he was young. Mom had dementia. That's only like 20%, sometimes even less. It's more about our lifestyle, what we eat, how we move, how we love, how we pray, how we connect, how we learn. That has more of an impact than anything. So that
This is
should give
amazing.
people some hope.
Well, in my case, I certainly hope it's the genes because my mom's almost
You've
106.
got two, but you've got
I have,
two things going for you, Valerie, right? You've got genes, but you also, here you are, you've told me your story. You're doing a talk show. You're still working. You're
yeah.
engaged. You're learning. So you're going to surpass most of us.
Well, I certainly hope that my genes help me a lot. That's
I
for
think
sure.
they will.
Where
You've got a good thing going.
Oh, thank you. So where do people find these 7 pillars of wellness?
I actually use the international what is the name of the International Active Aging Oh gosh, went right out my head there. I'm gonna have to look that up. But there's several different pillars of wellness, but I go through the International Council on Active Aging, I believe it is. Sorry, it's quite a
Okay.
mouthful.
Yeah, maybe
International
you can.
Council on Active Aging. But
Right.
you can look up many of the pillars. There's everybody has a different opinion, but I like to go by the Council for Aging so that I really focus most on what's important to older adults. And two of the things that I talk about a lot, besides just the normal things of you have to move, I always tell people, you want the good news or the bad news? The good news is you can't get away with just being sedentary your whole life. You have to move in some way, shape, or form. And, we could spend a whole hour talking about exercise. But then I also think the other important one, we're hearing this more and more now, which I'm glad, is connections. We have to have social connections. And the research shows that loneliness is as dangerous as smoking 15 cigarettes a day.
That is a pretty powerful statement.
That kind of blows people away when I tell them that. And that's being spread. I mean, I hear that all the time now. So people are starting to talk, and it's not just aging people. Clearly, our younger population has a pretty big issue with mental health and depression and anxiety. And so we need each other. You can't live in this world without um, people needing people. I mean, we all need human touch, human kindness, somebody to look us in the eye and smile. And that doesn't mean you have to be an extrovert and have 500 friends and go out every night. It means that you have to have somebody or a handful of people in your life that you can pick up the phone and talk to, that you see, that care about you and that you care about. And then the other one is purpose. Got to have a sense of purpose. And many people do retire and then they pass away not long afterwards because purpose was work. And then all of a sudden,
Yeah.
work's no longer there, and they haven't found a way to bring in other things in their life. And that could be as simple as, I knit scarves for, refugees. I work at the homeless shelter. I get up every morning and just get out and wave to my neighbors and talk to the kids getting on the school bus. Doesn't matter what it is.
Right.
We have to have a reason to
Right.
be alive.
Right. Absolutely. And just be a part of the community, be a part of,
Anything.
participate in your life.
Yes. And again, what matters to you, what matters to me doesn't matter to you. So you have to define, well, what would my purpose look like? You know?
Yeah. Yeah. And it seems that when people are in even like assisted living communities where you've got a controlled, not a controlled group, but it seems like they could have sessions on, what would you like to be, right? What
Right.
would you like to do? What would you like to be? And that we should be doing that in the community and then helping people get connected.
Mm-hmm.
And I'm
Yeah.
sure there is some of that, but I don't know how intentional it is.
Yeah. Yeah.
How do you encourage adults to redefine their purpose? What can they do? How do they do this?
Yeah, that's a
I mean,
good
you're a care
question.
manager, so that's good for you when you're one-on-one, but what about when you're not? Should we be having classes? Should we
Yeah.
be
Yeah. Yeah, and I kind of do that in my one-on-one things, and then even with when I go out and speak to groups, I talk about it. But I'm glad that you say that because I think I always try to give homework. I give them things to when I leave here. Now this is not done. I want you to go forth and talk to your friends about this. And so I do have a little bit of a worksheet that I hand out to people, but I think I could develop that out even more. And I try to do a lot on social media, and I'm like, okay, when I put my husband on there and he's cute and funny, everybody get replies. But when I get on there and talk about aging, it's crickets. But people are listening, but more of that too.
how do you help families navigate all the emotional complexities?
Families, I think for them, just to know that they're not alone is first of all important, and to know that so often the feelings that they're feeling are normal. right? That just gives them a huge amount of relief, right? Especially when, even when they, it's a very loving, good relationship. And not all families have that, right? So I think just knowing sometimes that this is normal, it's okay, that you can't fix or solve all these problems, but let's just focus on one. What is the immediate need? Safety is always number one. When we're in that crisis and there's so many things going on, everybody wants to look weeks down the road. They want to look back. What happened? We have to stay right here at the moment. Mom's in the hospital. What happened? What are our opportunities? What's next? And just knowing, people just don't understand the continuum of care. And unfortunately,
Yeah.
they don't understand how complicated it is. And the options sometimes are limited, and there aren't always good solutions.
As a care manager, are you usually contacted by the children or by the
Yeah.
patient themselves?
Traditionally, it's the family. It sort of takes the control out of the older adult. But I'm always like, to me, the client is the older adult. And the family may have hired me, but I'm still working and doing everything that I can for that person. But I have to balance both needs, right?
So,
Yeah.
just for the benefit of our audience, our
Yeah.
listeners, and our viewers, let's just define what is a care manager.
Yeah. Well, that's a good question too, because I think everybody approaches it a little bit differently. So, as I mentioned, I'm a gerontologist. So when I approach, working with a client, I look again holistically at trying to help them, empower them, help them present them with the options, help them understand the future, and just kind of approach it from that way. But then somebody who's clinical, you could have somebody who's got a very complex health situation. They might need a nurse care manager who could really go in and understand the disease process, perhaps navigate some complications and things going on within the healthcare system, uh, billing, insurance, some of those complications. So it depends on what they need. And I think a good care manager is going to approach it and say, I'm not sure I'm the person that can help you, but let me find somebody who can, because I know my strengths, and my strengths really is in lifting that person up and helping them, make some choices for their lives, but also feeling like they have autonomy, and that I'm doing I'm working for them to help them. And other times it's more complicated, and there needs to be perhaps nurse, more clinical intervention. So it's like anything else in life, a therapy or a good husband. You got to do your homework.
You do. That's true. That is so true. So, just again, for the benefit of those who don't know, how old does someone need to be a good candidate to have a gerontologist in their life?
Oh gosh, I don't think it's age specific at all, because as we know, somebody who could be, 48, and going through a huge crisis in their life, a change in their health status. Maybe it's Parkinson's, maybe it's dementia. I had one client who was fairly young, but he fell off of a roof. Do not get up on the roof, people. I'm telling you, do not get up there and try to clean your gutters. And he was completely disabled. Um,
Oh,
and then, his life just like that changed. So they needed somebody to sort of help them understand the healthcare system and what's available. And, you start talking about Medicare, Medicaid, long-term care, people don't understand. I mean, we live this space, and even sometimes we don't understand, but we
and so
find
how
out.
does someone benefit by hiring a gerontologist? What does a gerontologist do? What is their role?
Mhm. From my perspective, it's really just to help them look holistically at their life and understand that aging has, many components to it, and it's just not just our health. I could be somebody who's older, who has some health issues, but who is still very vibrant and has things that they want to do in their life. So I don't think that it's age specific. I think it really has to do with looking forward on your aging journey to say, what does this look like for me? What are my options? Some people think automatically, well, I have early stage dementia, I have to move from my home. No, not necessarily, you know. So helping them understand options, resources, how things are paid for, um, um, and just to help them with those choices and understand that they have the rights to make decisions that are best for their values, beliefs, and preferences.
And what are some of the trends that you see? We've talked about this now that there are so many more older
Mm-hmm,
adults.
mm-hmm.
What are some of the trends or exciting things that you see coming along?
Yeah. I love that we're just talking much more about health and longevity and lifestyle. Lifestyle, which in components really the wellness model that I've talked about. So it's
Right.
how we live. It's do we get enough sleep? Do we move our bodies? Do we have relationships? Are we spiritual? Do we get out in nature and all of those kind of things? So there is so much more emphasis. And I think another trend that I see is people, I don't want to say are questioning healthcare, but they're also knowing that the healthcare system doesn't necessarily work really well for aging people, right? I see this time and time again. We know that doctors have on average, what, I think a primary care is 6 minutes with a person. So
Yep.
you have to, so it's another thing I talk a lot about is, what do you think a doctor is going to do for you in 6 minutes? Do they know how you live? Do you know how you eat, sleep, what your life is like? No, they don't. So I think we're seeing more of a push of people taking ownership of their health and looking at alternative ways to manage. My personal experience, I have an autoimmune disease that caused psoriatic arthritis in my feet and hands, which was debilitating, scalp psoriasis, all these things. I was on medication for that. It got all those things managed, but then I was sick all the time.
Yeah.
And then I got shingles, and that
Um,
nearly threw me over the edge. So I decided that rheumatology and drugs was not for me. I have to practice what I preach. So I
mhm.
thought that's not sustainable. So I went to an integrative health practitioner, and we're doing all kinds of blood work and we're looking at food sensitivities. Why do I have autoimmune? Why is my body on fire? What can I do? What lifestyle changes can I make to live a healthier life? So I think, and we're just, you can listen to podcasts for hours and learn so much more about your health and what you can do. So I do think that that's a trend that's very positive, that I've been waiting for, 30 years for.
Right. To be much more self-aware
Yes.
and more responsible for yourself.
Yes. So we have to take responsibility. You can't just go to your doctor and they say, "Oh, go have this test." I mean, my aunt was at a doctor yesterday, and she's got some tests that came back, and they're trying to make sense of it. And this doctor says, Do you need some pain medication?" I'm like,
Right.
this doctor doesn't know her,
No,
and it wouldn't be a good idea.
no, no. Well, that's a whole nother subject. We'll wait for
That's a
another
whole
day.
other subject, but people are taking there's more ways for us to learn. There's so much knowledge at our fingertips that we can learn, and consult with our physicians to make the best choices for ourselves.
Right. Right. Rather than the going to the doctor being a social event, which it is for so many older
Oh,
people.
it just takes
Yep.
them the whole
You're-
day to get to the doctor and back. And then they want you to come for a follow up. For what? What am I here for? Ask those
I know.
questions. That's what
I
I
know. I
encourage
know.
people to do. Just don't assume anything, that you are in charge of your own health. So ask a lot of questions and do what's right for you.
Yep, absolutely. Thank you so much, April Ibarra, for joining us today and reminding us that aging isn't something to brace for, but it's something to embrace and plan with purpose and intention. So, whether you're an older adult, whether you are the adult child of aging parents, you're planning your own next chapter, or simply just looking for clarity in a complex situation,
Mhm.
today's conversation gave us a powerful reminder, didn't it, that you shape your future no matter what your age is, that you do have choices and you can make your own future. You have some influence. So until next week, stay curious, stay connected, keep living life boldly and with a lot of fun. And for sure, always stay ageless. Thank you, April, very much.
Thank you, Valerie.